Good job today, Kayla. I really see you progressing as a student nurse. Tomorrow we'll be meeting with Mr. and Mrs. Rogers. Would you like me to give you a little bit of background in case you have any questions or want to look anything up?
Yeah, that sounds great.
Okay, so our patient for tomorrow is Mr. and Mr. Rogers. Mr. Rogers has a history of Parkinson's and high cholesterol, and Ms. Rogers has a history of hypertension and diabetes. So I've been seeing these patients for the last 2 months, so I know a little bit about them. So tomorrow will just be a routine checkup where we'll be checking if they are progressing in their ADLs and following their strict medication.
Okay, and I remember learning that you have to call the patients ahead of time to make sure that the time is convenient with them.
Yes, I've already called and they said that 10 a.m. is the best time for them, and I've also told them that a student nurse will be coming with me, and they said that is absolutely fine.
Okay, sounds great. I can't wait to meet them.
Good morning. Let me help you down the stairs.
Good morning. I'm not feeling great today. I'm shaking more than usual.
I can see that.
I've been taking the medication for a week. Thought I would have been better by now.
Well, when Nurse Amanda gets here, we can go ask her. Alright, here's your levodopa and carbidopa and some eggs. Hopefully eating your breakfast and taking your medication will help. Also, here's your atorvastatin for your high cholesterol.
Thanks. You take your medication this morning?
Yes, I took all of them this morning. The only one I haven't taken is Lasix, which I'll be taking later.
I heard you getting up a lot last night. Is everything okay?
Yeah, everything's fine, but for some reason, I kept getting up to use the restroom. I didn't sleep as well as I usually do because of that.
That doesn't sound good. Maybe you could ask Amanda when she gets here.
Yes, I'll definitely talk to her about that when she gets here.
So today's our visit with Mr. and Mr. Rogers. Do you have any questions before we go in about what I told you yesterday?
No, not that I can think of, but maybe after the visit I will.
All right, let's go.
Hey, Amanda.
Good morning, Mr. Rogers.
How
Good
are you?
morning.
Good morning.
Mr. Rogers, this is Kayla, the student nurse that I was telling you about.
Nice to meet you.
You too. How are you feeling this
Not
morning?
that great today.
Where's Miss Rogers?
Oh, she's sitting on the couch watching TV.
Can we go see her?
Sure, let's go.
Good morning, Miss Rogers. How are you feeling today?
Hi, I'm feeling great today.
This is Kayla, the student nurse I was telling you about. She's gonna take your and your husband's vitals if that's okay.
Sure, that's no problem. Hi, how are you? I'm good.
Thank you. Okay, first I'm going to start with your blood pressure. Okay, so I got 180/90.
Oh wow, that's not bad. That's usually what I am.
And take your temperature.
Hold on. Honey, it's almost your turn. Can you come in here now?
Okay, under your tongue. Okay, it's 97.6. Hi, Mr. Rogers.
Hi,
I'm just
how
going
are
to take your blood pressure really quick. and your blood pressure was 130 over 70.
That's about right.
Hey Amanda.
What's up?
I just have a question. I noticed when I was taking Mr. Rogers' blood pressure that he was a bit shaky.
That's a very good observation. Let's go talk to him and see what's going on with that. Mr. Rogers, I noticed that you're a bit more shaky than when I saw you last. Have you been taking your levodopa for your Parkinson's?
Yeah, I just started taking it last week.
That's why. So the effects may not be noticeable for several weeks to months, so we will keep an eye on your progress. Even though you aren't seeing any effects yet, you should still make sure to be taking your meds. Have you also been taking your atorvastatin for cholesterol?
Yes, I took that this morning also.
Should he be taking that medication in the morning?
No, Mr. Rogers, you're supposed to be taking that medication at night, not the morning.
Why is that?
Then this med will have a better effect because your cholesterol is made at night.
Oh, I didn't know
Okay,
that.
Mr. Rogers, we're gonna go check on Miss Rogers. We'll be back.
Okay.
Do you want me to pass you the remote?
Yes, please. Thank you.
No problem.
Miss Rogers, are you taking all of your medications?
Yes, I'm taking all my medications. I take metformin and metoprolol in the morning, and I take Lasix at night.
You know that certain medications should be used at certain times. Lasix is a medication that you should be taking in the morning because it makes you use the restroom a lot.
Oh, that might be why I'm getting up all night.
Wait, Amanda, I heard her say metformin. What is that used for again?
Metformin is a medication used for type 2 diabetes. If you become tired or sore, stop taking the medication and call your doctor and he will tell you what to do.
Okay, great. Is there anything else that I need to know?
It is very important that you keep up with taking all your medications daily and that you are aware of when you should be taking them. If you ever have any questions, do not hesitate to ask. Different medications have different side effects, so if you are feeling unusual, call your primary care provider.
Okay, great. Will do.
I see here that you're going for a CT scan with contrast next week. Make sure that you discontinue your metformin 2 days before you go.
Okay, thanks. I'll make sure to stop it 2 days prior.
Okay, Miss Rogers, so that's it for today, but I just have one more thing that I needed to ask. I see here on your chart that you don't have any advanced directives. Do you need more information about that?
Yes, I do, but I think my husband should be in here for this.
Oh, no worries. I'll go get it.
So before I leave, I just wanted to talk to you two about advanced directives because I noticed you guys don't have any.
What is an advance directive?
An advanced directive is a living will that allows you to document your wishes concerning medical treatments at the end of life. I can also give you information about a medical healthcare proxy, which allows you to appoint a person you trust as your healthcare agent or surrogate decision maker who is authorized to make medical decisions on your behalf.
What do I do with my advance directive after I fill it out?
Make sure you talk with your loved ones first about what your advance directive says. Also, make copies of your advance directive to give to your loved ones, caregivers, and doctor.
What if either one of us needs to go to the hospital?
Yes, you have to bring it to the hospital as well. Here are some pamphlets about advance directives that you can look over, and we can discuss it the next time I return.
Perfect, thank
So
you.
that's it for today. Is there anything else that you guys need before I leave?
No, I'm good.
I'm okay.
Right, I'm gonna go watch the news now.
All right.
Thank you.
I'll see you guys next week. I'll be back. So do you have any questions about today?
No, thank you so much. I feel like I really learned a lot.
Okay, perfect. Well, it's a little past your time, so you could go and we'll meet back here next week.
Okay, sounds good.
Perfect.
Go.
So to review, here are some key concepts. When taking atorvastatin for high cholesterol, be sure to take it at night since cholesterol is synthesized in the evening. If you are going to undergo a procedure with contrast, be sure to stop taking metformin 2 days prior. Also for metformin, if you are sluggish or experiencing myalgia, contact your primary care provider since these are signs of lactic acidosis. Safety is a big concern in the elderly population. It is important to inform these patients of full precautions such as keeping the nightlight on, having no throw rugs, and that cords are put away properly. Also make sure things are easily accessible, especially medications. And number 4, make sure to ask your patient if they have advanced directives or if they need information on it. It is important to make sure that their wishes are heard.